I am Riccardo Vinciguerra. I work in Humanitas San Pio X Hospital and Humanitas Rozzano in Italy, and I'm a scientific responsible for Humanitas San Pio X Hospital. I do refractive surgery, cornea and glaucoma, plus obviously cataract surgery. Foresight is a software that I've been developing with an engineer, Harald Studer, for more than 10 years. The project was to create a software to predict early post-op outcomes of refractive surgery, plus the long term. So basically to let the patient and the doctor know how the cornea will be in a year time. So to know that your refractive procedure will be actually successful. So this project started many years ago, and since a few years this has been part of the Schwinn family. So now we are starting with the first part of the project, which is the Smart Foresight. That is the idea to show how your cornea will look like in the early post-op. So basically you have a pre-op cornea map, you subtract the ablation profile, and the software will be able to show you not only the tangential map, but any map potentially that your patient will have. So axial map, pachymetry map, anterior, posterior elevation. So you know before doing the surgery, before pressing the pedal, how the cornea will look like, and you can decide how to change the optical zone, your offset, or maybe the use or not of high order aberration. I think that in general this is for every patient. I am going to show tomorrow in the users meeting a case of an absolutely normal patient with like normal pachymetry and 4 diopters of myopia. This patient just had a high decentration, so he had an high angle cap. And I showed how we were able to use the correct offset to treat this patient correctly. Obviously, this will also help in difficult patients, because if you know beforehand how your treatment will be, this will help a lot. But I think this can help every patient that we do. So the next will be to implement the regression. So we are able now to see how the cornea looks like in 1 week. But this is not what we want. Basically, what we want to know is, if I do a surgery, will this last for a year or for 2 years? So our idea now is to validate this project and to show that we are able to predict progression, and that will be the second step that hopefully will happen in 1 or 2 years. The last, and that's a very important project, not only to know that the patient will regress, but if we know that the patient will regress, automatically the software laser could suggest a different ablation so the patient will not regress.